Hey everybody, we are back with Dr. William Lee. He is a physician, scientist, and the president and medical director of the Angiogenesis Foundation. In the last video, we talked about his book, Eat to Beat Disease, and we talked about the 5 defense mechanisms that our body has to defend us against disease and to support our health. In this video, we're going to dive into one of those defenses that's called angiogenesis. And I really want to just understand what angiogenesis is and what happens maybe when that defense mechanism fails us from a health standpoint, and then ultimately what can we do about it. So Dr. Lee, thank you for being back with us.
Thank you, Jameson. Well, let's just dive right in. Angiogenesis is actually a Greek word that actually is kind of easy to understand if you break it down. Angio is like blood or blood vessels. Genesis is the growth. And so angiogenesis is how our body grows blood vessels. And why are blood vessels important? It's because it's one of the health defense systems in the body. We've got 60,000 miles worth of blood vessels packed into our body as an adult. And those 60,000 miles are the highways and byways of health. Those channels and tubes deliver the oxygen that we breathe and the nutrients that we eat to every single cell and every single organ. So you can imagine how important blood vessels are. You don't have enough blood vessels, the organs starve, they start to die. Good example is after a heart attack, you don't actually have enough blood flow, heart tissue is destroyed, it dies. And same thing after a stroke. And so you really need to be able to make sure you have enough blood vessels. On the other hand, if you have too many blood vessels, more than you need, it can also be a problem because, look, our body is so, it's like a well-packed suitcase, no room for extras, all right? And so when you have too many blood vessels, those extra blood vessels can go on to cause trouble. They can leak and they can bleed. It's like the suitcase that busts open because they can't hold, there's too much clothes in it. Or even worse, these blood vessels can bring oxygen and nutrients to feed cancers. And that's a terrible situation. And in fact, in the last video, we talked a little bit about how cancers all start out as little microscopic, harmless little guys about the size of the tip of a ballpoint pen, can't grow any bigger because they don't have a blood supply. And in the lab, and I worked in the lab that actually started all of this, if we kept a little ball of avascular cancers, microscopic cancer doesn't have a blood supply, kept it isolated from a blood supply, it'll just stay there and stay there and stay there and never do anything bad. But the moment you actually allow blood vessels to touch and grow into that microscopic cancer, the blood vessels are bringing oxygen and nutrients, feeding that cancer that couldn't grow before, and it will grow 16,000 times in volume in 2 weeks. So angiogenesis is a trigger for allowing cancers to grow. Now, your body uses this defense system to prevent cancers from growing by making sure there's never extra blood vessels. There's always enough. Okay, so if they see a bald spot, it's like a gardener. You see an area that needs more blood vessels, you sprinkle the grass seed to get more grass to grow. If they ever see too many blood vessels that are trying to grow, it's like the gardener. They'll mow down those extra blood vessels so you never have too many. In fact, our angiogenesis system maintains that 60,000 mile channel with what I call a zone of normalcy. We call it homeostasis. And this zone is always it always has just enough, not too little, not too much. It's called the Goldilocks zone, actually, like the 3 bears, not too hot, not too cold, not too hard, not too soft. Not too few blood vessels and not too many blood vessels, but just right. That's the angiogenesis defense system.
Got it. So it's a very regulatory system.
That's right.
So from a cancer standpoint, talked about that would be a too much end of the spectrum. What's an example of a disease that would be caused by too little angiogenesis?
Great question. One of them would be in diabetes. Many people with diabetes have difficulty healing wounds, particularly on their feet.
Okay.
And so they step on something hard. They can't feel that they injured themselves. in diabetic feet, they have difficulty growing blood vessels, no healing, the wound gets infected. And that's unfortunately one of the common causes of amputation, leg
Got it.
amputation with diabetes. Heart attack. Okay, when the heart gets clogged, you need more blood vessels to grow. If you can't grow more blood vessels to bypass that channel naturally, well, the surgeon might have to come in and bypass it mechanically for you. And that can be life saving. But that's a big deal as well. So angiogenesis naturally tries to defend blockages there as well. And by the way, on the other side, too many blood vessels, besides cancer,
Hmm.
is the most common causes of blindness in people who have diabetes or who are elderly.
Okay.
Macular degeneration for the elderly, and diabetic retinopathy, blood vessels, extra blood vessels growing in the back of the eye and leaking. Your
Hmm.
eye has to be crystal clear like an aquarium. Okay. When blood vessels grow and leak, you completely prevent light from going through that little tiny clear ball, and now you can't see anything. So, just right is super important. If you got too
Yeah.
many, it can feed cancers. And that's what led the biotech community, and I was part of this effort, to try and develop new treatments that are very specific and targeting the blood vessels feeding cancer. It's called anti-angiogenic therapy. It's a fourth modality for treating cancer. You've got surgery, chemotherapy, radiation, and anti-angiogenesis.
Got it. Okay, so let's transition then into the kind of biomedical side. What are we've talked about it in the last video a little bit. A few of the medications that are out there, like Avastin, is I think the
Yeah,
first, right? Avastin was the first.
yeah, right, right. So there are about a dozen different
Yeah.
anti-angiogenic, cancer-starving, mow down those extra blood vessels, help your body's defenses keep the Goldilocks zone,
Hmm.
and like let's knock out those cancers. And medications that starve a cancer by cutting off the blood supply. There's a lot of them. There's Avastin, which has been approved for colon cancer and lung
Hmm.
cancer and brain cancer and kidney cancer. Look, I mean, with all these approvals, it's because every single cancer actually depends on a blood supply. It's
Right.
agnostic. It doesn't matter where it starts, it still
Right.
requires a blood supply. So it always works. Now you've got kidney cancer ones like everolimus, Afinitor, Toracel. There's a Pazapanib. There's a whole bunch of those as well. There's Sorafenib and Nexivar for the liver. The list goes on. It really is a kind of a pantheon
Hmm.
of game-changing drugs for cancer patients, largely because these are not chemotherapy drugs. Some of them are
Right.
given by themselves. Some of them are given with chemotherapy, but they all lack the side effects of chemotherapy because they're pretty specific in cutting off the blood supply to tumors. Now we're beginning to realize, by the way, that anti-angiogenic cancer-starving drugs also partners well with immune therapies as well.
Ah. Okay.
So I talked about the four modalities for treat
Yep.
cancer, surgery, chemo, radiation, anti-angiogenesis. The fifth is actually immunotherapy. And that's where you
Immunotherapy.
use one of your body's health defenses to, you train your own defense to go after
Hmm.
the cancer. But anti-angiogenesis, cutting off the blood supply, those blood vessels that tumors release actually repel immune cells. So if you
Oh,
actually
interesting.
starve the cancer, it allows your immune system to go after the cancer better. So we can actually now have a 1-2 punch
Yeah.
right to cancer. So this is really the biomedical side of it.
Hmm.
And with these types of treatments, we've been able to achieve progress for patients that we haven't been able. We never thought we'd actually see. I certainly never thought I'd see it in my career, and here we are. Like the hits keep on coming. Like every single year, there's more and more exciting progress being made. It's actually an incredibly exciting time for people who are doing cancer research and cancer
Mm,
treatment. It never gets to be a less scary time for a patient to be diagnosed with a cancer,
that's fair.
but progress gives us hope like
Yeah.
never before.
Yeah, that was one of the things, if we sidestep the topic for a moment, that was one of the things our doctor described to us pretty early was we're in this really exciting window of medical research where um, it's almost less about what do we have today to cure disease and more about what do we have today to manage disease because a cure is very close on the horizon. that for someone like Rachel, my wife, who had stage 4 colon cancer, already spread to her liver, already spread to lymph nodes, 10, 15 years ago, that may have been, I mean, truly a death sentence, kind of a like, we have nothing for you medically, get your affairs in order. And we're already at a place where we have curative measures, we have management measures that really take it. You're right, it's still scary, and there's a lot of emotion behind it, but really take it to a place of we can manage the disease, knowing that advancements are coming that we can't even imagine today. But we've been in this 4 years. We've already seen some of those advancements. We've seen new medications coming out, new research coming out that is specific to Rachel's type of cancer, and that's really exciting.
Exactly. No, I mean, and we're, even with immunotherapies, we're beginning to see results that are hard to believe and yet are completely true, which is that people with stage 3 or stage 4 colon and other forms of cancer, if their immune system is given the opportunity, can literally wipe out all the cancer in the body, kind of like an eraser on a dry erase board, like literally just wipe it away and it's gone. And my own mother had endometrial cancer, which is a cancer of the lining of the uterus. She had surgery. A little cuff of cancer cells were found during the pathology, and she had a little radiation, and she shouldn't have actually. Her chances of recurrence were really, really low. But unfortunately for her, within a year, the thing came roaring back and it went everywhere. And again, the idea that was this was only about 7 years ago. Death sentence, nothing we can do. In fact, her oncologist said, take her on a cruise because she's feeling well, because there's nothing we can offer. Enter immunotherapy. And immunotherapy combined with a little bit of other radiation, actually in only 3 treatments, every 3 weeks apart, literally dry erased all of the cancer in the body. And we kept on treating for like a year. But we didn't know what we were treating, so we stopped. And now it is 7 years later. My mother doesn't even remember she had cancer.
That is incredible. Wow.
So we're seeing this.
Yeah, absolutely. So a question about anti-angiogenic medications. I mean, just based on the name of it, it sounds like its purpose is less about regulating angiogenesis and more about stopping the overgrowth of angiogenesis.
That's correct.
Okay, so what happens if a medication causes too much anti-angiogenesis? Is that a risk from the biomedical side of things, that it's going to swing you too far?
It can. That's why if you're taking a medicine like Avastin, before you had surgery, they'd stop that treatment for a few weeks. But actually, they probably don't even need to stop it more than a week, to be honest with you. It's because your body's health defenses are so vibrant and so robust. Once you stop that medicine, anything that's been overly done, grow right back. It's like your body just throws a ton of grass seed into that bald patch, and it'll be no problem. And so, and this, by the way, actually takes us into food as medicine, because while biomedicines are basically, chemo is kind of like is a true blunt instrument. I mean, it's really a battering ram going against the cancer, and along the way, you're going to knock out some of your healthy cells as well. Right. Targeted therapies are more like the tip of the spear. Okay, it really pokes at it. Foods, actually, all foods can do is to help your body's health defenses do what it does even better. So foods that are anti-angiogenic, like green tea or tomatoes or soy or oregano, walnuts, what they do is they actually just help your body mow down those extra blood vessels. They can't really create any shortage of blood vessels. They're not powerful enough.
Right.
And your body, again, will put in whatever it needs. And then foods that grow blood vessels, like apple peel, or fruit peel, like barley, like dark chocolate, they can help to restore blood vessels where your body needs a little help on that defense. Okay, but they can't overgrow. So you don't have to worry about eating foods that will help support angiogenesis and overgrowing. And because it really is that Goldilocks zone. The body
Yeah.
knows how to keep everything within that zone.
Got it. Okay. So yeah, if we talk about foods, um, where do you see foods specifically assisting in a, let's just take a specific scenario of a cancer patient who is looking at a medication like Avastin because they recognize their type of cancer is significantly affected by angiogenesis, and so they're looking to bring that down. What is your recommendation from a food standpoint to bring about the results that they're looking for?
Yeah. Well, I mean, look, first of all cancers depend on angiogenesis.
Fair enough.
Avastin is approved for very specific types of cancers. So that's sort of the guidelines that the oncologist will actually stick to in general. On the other hand, what I will tell you is that these treatments, these infusions or pills, but let's talk about infusions for a second. You go to the oncology clinic or the infusion unit, every 2 weeks or so, and you're getting the medication. That's kind of what we call healthcare, right? That is disease care.
Right.
But what happens between infusions? That's healthcare. That's what we do by
Mm,
ourselves, for ourselves at home. And long gone are the days where, like, well, I don't know, I don't do anything in my house for myself. I wait for my doctor to do it for me. Now, what we know with food as medicine is there are steps that we can take to shore up our own body's health defenses. One is eating foods that are anti-angiogenic.
mm,
Second, by the way, all these other health defenses also come to the rescue. Stem cells. You want to
right.
regenerate any organs that may have been damaged by chemo. You might want to target some of the stem cells that cancers actually use to come back as well. Microbiome. Got to lower that inflammation. Okay. Make yourself feel better by text messaging your brain and releasing some of those happier, healthier for your emotional health hormones. DNA. Let's go fix some of that stuff that radiation or chemo damaged,
Right.
and then immunity. This is probably where the money shot is. We absolutely all need to actually build up our immunity. So let me tell you an incredible clinical study that was actually done involving 800 cancer patients with stage 3 colorectal cancer, colon
Okay.
cancer. About 14 major cancer centers participated in this. They looked at the cancer patients who had surgery, radiation, chemo, targeted therapy, followed them for 5 years. And they asked them, in addition to the treatments, what did they eat? And here's what they found. The patients who ate 2 fistfuls, 2 handfuls, 2 cups
Hmm.
of tree nuts, walnuts, pistachios, almonds, macadamias, that kind of stuff, okay, they had a 57% decrease in the risk of mortality.
Really?
Now, how might that work? Well, then you go back and you take a look at, I mean, compared to people who didn't eat any tree nuts,
Right.
how
Right.
might that work? And this is, by the way, presented at ASCO, okay, and it was published in the Journal of the Journal of Clinical Oncology. These are
Hmm.
mainstream journals,
Yeah.
okay, this is
Yeah.
not alternative medicine, and these are all major cancer centers, the Dana Farber, Duke, all these
Hmm.
centers came forward to do this clinical trial, and it's not about nut therapy. It's really just showing the impact of diet
Right.
um,
Right.
in the background and bringing it into focus in the forefront of how important that actually is. So why do we think that's important? Well, walnuts and tree nuts are a good source of natural omega-3 fatty acids, which
Hmm.
are anti-angiogenic. Okay, so
Okay.
walnuts are an
Yep.
anti-angiogenic food. Now you're actually adding something good to help your body mow down those extra blood vessels for the tumor. Walnuts also have dietary fiber. Dietary fiber feeds your gut
Your
microbiome. Bacteria
microbiome. Yep.
release anti-inflammatory substances, which are going to tip the balance in your favor when it comes to cancer. Oh, the gut microbiome also talks to the immune system, which
Hmm.
helps wipe out any of those microscopic cancers and even the big cancers. It's even more important to chip away the big cancer. And walnuts specifically have been found to have a natural chemical that kills colon cancer stem cells.
I have read that research actually. Yeah.
So
Very
this is an
interesting.
example with a clinical outcome where food as medicine makes a difference. It's not food versus chemo. No,
Right.
we're not talking about that. We're saying that the food, if you're somebody who is battling cancer and you're getting treated, you should just know that although your doctor might say, it doesn't matter, just eat, get enough nutrition, gain, you don't want to lose weight, just gain weight. Nobody's telling you to go to the drive-through of the fast food place. Okay.
Right.
Right? I'm telling you that the scientific data is building every single week, that the foods that we eat that activate our body's health defenses help tip the balance in your body in favor of you surviving your cancer.
Hmm. Yeah, that's fascinating, and that is encouraging. How it does feel like the dialogue is changing, at least with a lot of doctors that we speak with. Where there was someone I spoke with, a patient I spoke with that was a breast cancer survivor, had been in remission for many years, but she described the advice from her oncologist that the goal was do not lose weight. Right? Okay, that's probably a fair goal. There are markers that say when you lose weight, it affects the immune system and things like that. But what she found was that the only thing she felt comfortable eating was a pack of bacon and orange soda from McDonald's. Those are the two things that she felt like she could stomach. This is, again, many years ago. And her oncologist was like, perfect. That's plenty of calories. That'll keep your weight up. Do it. And she did. And again, she is a breast cancer survivor. There's a happy ending there. But there's just so much around that I would be shocked to find a doctor today that would have the same advice, right? Doctors are going to vary in their understanding of diet. I think, you talk about in the book how it's like still like 14% of medical colleges even teach on diet and nutrition. But it does seem like the trend is moving towards healthier eating. You hear a lot about Mediterranean diet from oncologists. So even if they don't really have an in-depth understanding, they're at least seeing some relationship between healthy diet and health.
Well, you know what's happening, Jameson, is that the thing about medicine is that there's a new crop of young doctors that are being minted and produced every single year. Yeah. And while the older people that are retiring and fading out and rotating off their practices, might have been educated in the 70s and 80s where there was no attention given to nutrition. I mean, back then, if you went jogging, like that was enough for you to be healthy for the rest of your life. It's supposed to be the longevity solution by just going, putting on your Adidas and going for a run. And
you might smoke a pack a day, but as long as you're running, yeah.
But now I think that the younger doctors that are coming out and they're being minted every single July. They're entering residency, they're finishing residency, going to clinical practice. These are people that are much more aware, both for their patients, but also importantly for themselves, just how important the role of diet is. And so I think we're going to see this dialogue change more and more and more. Yeah. Where I'm coming in on this is really the science is giving finally doctors the solid evidence and the vocabulary to be able to actually describe for their patients why it actually works.
Yeah, that's cool. I think it's an exciting trend that we're seeing for sure. All right, well, Dr. Lee, thank you for joining us on this topic of angiogenesis, and I feel like I just learned about 14 new things that I'm going to have to go make notes on and look into further. Particularly that study that you talked about sounds pretty fascinating. But thank you for joining us.
Thank you, Jameson.